Hey guys, time to get the doc on. Turn on again.
How's it?
So,
Hi, I
Dr.
think we can.
Olarogun.
Hello
Okay, here
there.
we go. I can see your face now.
Good.
We did it! Yay!
Yeah, we are in there. I'm just gonna make
Okay,
sure that
exciting,
this
exciting.
is that okay? It's a little bit sort
That's
of.
perfect.
Is that good? Okay, perfect. Good.
That's perfect. I'm so glad that we finally got you.
It's a pleasure.
I was having a bit of sweats here. I was worried it's not going to happen. I was like, it has to happen. There's so many women that's waiting for this talk, and I'm seeing
Right.
everyone starting to join. Thanks, guys, for coming back. So again, we've got Dr. Femi Olarogun. Thanks for everyone who's joining now on Fertility Talk. And we've got Dr. Femi Olarogun. He is a fertility specialist at the Hart Fertility Clinic, which is in Cape Town. But I do know that I know we've got a few ladies from Namibia as well that joins us. So you guys have the Cape Windhoek clinic
Fertility
as
clinic.
well. So those that are in the Windhoek area, Namibia area,
Yep.
doctor is there as well. I see you've got quite a few fans, I want to call them, saying hi, Dr. O. Yeah, so thanks so much for joining us. This topic is quite big, and I think that's why we had such a big response. I think we had like 160 or 170 people liking this
Mhm.
post because so many women are in their 40s that are actually trying to conceive. I know quite a few of them. So it's quite a big topic. So ladies, if you have any questions other than this, we're going to try and get through half an hour with stuff on this topic. If you have any questions, please put it in the comment section. We're going to try and answer it. Otherwise, Doc's going to give his details at the end of the talk, and you'll be able to contact him directly. So again, Dr. Olarogun, thank you very much for joining us on Fertility
Pleasures.
Talk.
Pleasures all
I hope
mine.
this is not the last one.
No, I'm sure we'll do a few more. I'm looking forward to it.
Okay, awesome, awesome.
All right.
So again, the topic is conceiving in your 40s. And then, first of all, can you please give a brief description of where you're from and just a bit about you, Doc?
Sure. So, I mean, I do fertility in Cape Town. I specialize at UCT, and I've been doing infertility for about 2 decades now. And I do private and public work, but most of my fertility work is done in the private sector. And like you mentioned, I am part of the Hart Clinic, and I also do work at Namibia as well. So we have an IVF clinic in Namibia as well, where we do IVF and do some fertility work there as well. So yeah, mostly private work, and involved with the academics. In a small capacity as well. I do a bit of teaching at British Ski when I have some time. So that's pretty much the background.
Yeah, you're quite busy, eh? It's very busy.
Yeah, no.
Um, so our first question is, does a woman's age impact her fertility?
Yeah, no, definitely. I mean, I think that's common knowledge. But just to put it in perspective for people, when a woman is born, when she comes out of the uterus and she's born, she has probably about 1 million eggs
Yeah.
that are in both ovaries, and that's the maximum number of eggs that they would actually have. By the time they get to puberty, so we're talking probably 13, 14, when they start having periods, that number comes down to about 300,000. So you lose almost like 30 eggs a day on average, from when you're born. So that number goes down from 1 million to about sort of 300,000 by the age of puberty. And it keeps getting lost all the way. So by the time you get to the age of 40, there's probably about 20,000 eggs left. And that's the one issue. So that's the number. The other issue is the quality of the egg. So in other words, as the eggs get older, the quality of the ability for those eggs to fertilize and implant and become a pregnancy is also compromised. And so your percentage, for instance, of miscarriage, just to put it in perspective, at the age of 40 is probably about 40%. While, in 20s, that figure is probably more like maybe 10, 15%. So it's the number of eggs and it's the quality of the eggs that is affected. So by the time one gets to 40, that equation unfortunately, shifts in the negative direction.
Oh, okay. What are the chances of conception each month at 40 and above?
Yeah, that's a good question. So if you're in your 20s, the chances of conceiving every month is about 20 to 25%. So some women might think that's actually quite low, but that means you've got a 1 in 4 chance of getting pregnant in a month that you're trying to get pregnant in your 20s.
Wow.
But from the factors that I've sort of described earlier, by the age of 40, that figure comes right down to about 5%. So the chances of then conceiving every month per month in a woman that is 40 years or over is about 5%. So that figure drops significantly. That is assuming that everything else is fine. So we're assuming that the sperms are okay, and the patient doesn't have endometriosis, and there's nothing else going on that could hinder fertility. Just based on statistics alone, the chances are about 5% every month by the age of 40.
Oh, okay. What are some of the risks associated with pregnancies later in life?
So I think the way to look at this would be to describe to put that into two different factors. What are the risks for the mother, and what are the fetal risks as well? So the risk for the mother would be the fact that the woman is now older, and what you're looking at is the chances of having pre-existing conditions. So in other words, gestational or diabetes, hypertension, thyroid disease, sometimes even cardiac disease is higher in your 40s than it is when you're in your 20s. And when you have those existing conditions and you get pregnant, pregnancy tends to make those conditions worse. So in other words, it complicates the pregnancy. So a patient, for instance, who's got high blood pressure before she gets pregnant, then has a higher risk of developing preeclampsia or eclampsia when they get pregnant.
Yeah.
And if you've got diabetes beforehand, then you have a higher risk of developing gestational diabetes and all the complications that go with it. And outside that, so apart from the pre-existing conditions that you have, you also have the risks inherent to the pregnancy itself. So in other words, a woman who's in her 40s is more likely to have complications in pregnancy than a woman who's in her 20s, for instance. So risk of premature delivery, placenta previa, bleeding in pregnancy, small for gestational age babies, risk of cesarean sections, risk of bleeding, all that is much higher in the patient that is 40. So those are the risks, in a nutshell, for the mom. For the baby, because of what I described earlier as the chromosomal abnormalities that could happen as you get older, in other words, the genes are not as competent as they were when they were younger, there is a higher risk of the baby having like congenital abnormalities, which will include things like Down syndrome and other kinds of syndrome that could actually affect the fetus. Having said that, I'm painting a very, very bad picture, but obviously the reality is that most women who still get pregnant in their 40s will probably still have normal kids. But the risks are just higher in that age group for the mom, and obviously to have an abnormal fetus compared to a woman who is, it's a comparative thing compared to somebody who's younger, for instance.
Okay. It's a question I don't have on the list, and I'm very sorry for it. But just because on what you said, when you're doing fertility treatments at Hart and you're in your 40s, is there anything that Hart does to make sure that the egg that is put back in the IVF process, there's a bigger chance of a normal pregnancy?
Mm-hmm. So what you're referring to there is what we call pre-implantation genetic diagnosis. So in other words, perhaps sampling the embryos prior to putting them back. So if you have, say, 4 or 5 embryos, for instance, you can, based on what we've described, maybe go and look at on because the patient is older, go and look at those embryos and then biopsy those embryos. In other words, take cells away from those embryos on day 5, for instance, and then freeze them. Send that to the laboratory, and then check which embryos are normal. And then at a later date, then put just the normal embryos back. So there are 2 problems associated with that. The one is the time, which I've described, because you have to do a biopsy and then wait, and the other problem is the cost. So, IVF itself is already quite a significant, incursion into people's pockets. So if you then throw in that part of it, it actually escalates the cost significantly. But it is available. It is available. It's something that can be offered. And in patients who have certain indications, perhaps in patients who've had recurrent pregnancy losses, and they're in the older age group, we might actually consider doing that, to help them out from that point. But it's a lot more expensive, so it's not something that we do.
Yeah, it's just the reason why I asked is just there's someone on the other side listening to this. It might be just put a damper on them. So just to let them know that this is available to them. Obviously at a cost, but it is available.
That's right. So the other issue is that obviously you can then, which is, again, I don't want to paint such a bad picture, but you can then sample all the embryos, and all of them are actually abnormal, and then at least if you do go down that route. So often, just to probably clarify that a little bit, in those women of that age group, you're not going to get 15 embryos. You're not going to get 10 embryos. So often you only have a few embryos to work from anyway. And instead of spending all that money doing the biopsies of those embryos, say you only have 1 or 2 embryos, you might as well just put it back and then see what happens. In that case, save the pregnancy. So that's another approach, to trying to deal with that.
Okay. Is there a cutoff age for fertility treatments, or does it depend on the patient themselves? I think it's a question I get asked a lot.
It's a difficult one to answer, because often patients come to you and despite whatever you say, they still want to try with their own eggs. Remember that you can get pregnant with donor eggs. So egg donation is available. And if, just from physiology alone, you can get a woman pregnant up to the age of 70, as long as it's not their own eggs, or whichever age. So in other words, if there's a donor that donates the egg for the recipient, you get the partner's sperms and you fertilize those, then you get embryos. Those embryos are young because you use young donors. And if she's got a normal uterus and everything else is fine, the chances of her getting pregnant is actually very good, no matter how old you are. So that's that group of patients. But I think what you're referring to are patients who want to use their own eggs. So if you want to use your own eggs, and the chances of getting pregnant is what I mentioned, over the age of 40 is about 5%, probably a bit higher if you're doing IVF. But by the time you get to about 44, the chances are so slim, even with IVF, that we probably already start recommending egg donation at that age, because the chances of success are probably about 2 or 3%, if that. So often at that age, you're probably talking egg donation already. So there's no cutoff age, because often the patient comes to you and says, despite all these figures that I've quoted, they will say to you, I still want to try with my own eggs, which is fair enough. Remember that every patient is on a journey. They've got to go through their own journey. They've got to get to a point where they feel comfortable to make that call, to say that, okay, now I've actually done everything. You know what I'm saying? So in other words, they've explored everything they can, and they feel more comfortable. Because if they haven't done that, they haven't got to that point in their journeys, there's something at the back of their mind saying, I didn't try that, that kind of thing. So you have to respect the fact that people are on different journeys, and you got to allow that to happen,
So I love your approach with this, doctor. So I can see why the ladies love the way you deal with them, because you understand their journeys. Okay, the next question is, while conception and pregnancy can be harder with age, we want people to know the odds are in their favor. Can you share some positive statistics for us?
So I mean, I probably have alluded to that already in terms of what the statistics are. The statistics are the statistics.
Yeah.
I mean, there are. I mean, if we in the fertility world could do things or find a particular thing that makes it easier for a 41 or 42-year-old to conceive compared to or bring their chances up to probably what they would have been in their 30s, then I think we'll probably all get a Nobel Prize for that. So the fact is that people do all sorts of things. We have all sorts of tricks that we try and do to try and improve the egg quality. We've tried all sorts of things in the past and to try and give that chance to that woman of her conceiving. And a lot of it is available. A lot of it we will try if, on discussion with the patient. But unfortunately, nothing really makes that figure go from what it is.
Yeah.
So the statistics I've given are what they are. So nothing that we do will make it jump from 5% back to 25%. You know what I'm saying? So it perhaps would increase the chances slightly. And I think as long as the patient understands that there are, a number of things we can try and modify the IVF cycle, things like, changing their diet, stop smoking, stop drinking, a better lifestyle would probably contribute. And that applies to both partners, would probably contribute to, the increase in their chances of success that way.
Okay. Before I ask the last one is, we've got a few questions that has come through. How do you prepare for a FET effectively? She's 42 years old, lost her twins to miscarriage last year, but super grateful to have had a successful, I was super grateful to have had successful, so she's had a successful IVF, but unfortunately she lost her twins. And how does she prepare now for a frozen egg transfer?
Yeah. I mean, look, the fact that I don't know if that twin pregnancy was from an FET as well, which if it was, that's a good sign. It means that, she did get pregnant. Unfortunately, it was a miscarriage. Twins inherently have a higher risk of miscarriage anyway. So that might have perhaps contributed to the reason why she did miscarry. To prepare for an FET is the same as you prepare for any pregnancy. Like I was saying earlier, you try and stop smoking, try and live a cleaner habit, cleaner lifestyle, if you like. And then you need to decide in conjunction with your fertility doctor if you're doing a natural cycle or if you're doing a medicated cycle to try and get the FET going. But it's the same story. Try and do things, that keeps your body in a state that is probably in a better position to receive pregnancy. If there are existing conditions like diabetes or insulin resistance or obesity, you might want to deal with those first. And that puts you in a better position, to have a successful pregnancy.
Okay. We've got another question is, what is the optimal age to conceive?
I think we kind of alluded to that. If you look at textbooks and all that, perhaps the best age to conceive is like 27, 28. But we all know that in this day and age, a 27 or 28-year-old is probably still busy with their careers, moving up in the world and trying to get things done, degrees and trying to get, their lives on an even keel. That it's probably a difficult time to try and get pregnant. And I see a lot of that in my practice. So by the time you're seeing patients, who are now ready to conceive, they're well into their 30s often, and sometimes even into their 40s, which is why we're having this discussion. But the optimal age, if, physiologically, when your body is absolutely ready and has a very good chance, less complications and all that, will probably be somewhere between 25 and 28.
Okay, that's good. We're getting questions. I got a question from Astrid, and she's asking about she was asking about egg donor. So I think to just answer on that quickly, we actually have to do another talk. We will be doing another talk on egg donor, because she's asking if it's going to have the same biology as the parent carrying it, and obviously it won't. But I think that's another topic all on its own. But just to answer quickly, if you can just give a short rundown on egg donation.
Sure. So egg donation, like I mentioned earlier, is available for older women, also available for younger women who might have ovarian failure. And what it is a younger person or a donor donates an egg or donates eggs for you to use, and those eggs are fertilized with your partner's sperm or with donor sperms if there are no partners, and then the embryos are then put back into the recipient, which is then the patient. To answer a question, biologically, so in terms of the genetics of that patient, of that baby, it will be the donor's genes and the partner's genes, if that's what we used, or the donor's genes and another donor's sperms, if that's what we used. So the genetic material would entirely belong to the donor. But the fact is that the baby is carried from day one in the uterus of the mom. And if you look at all the studies, we've done thousands and thousands all over the world of egg donation cycles. Those kids are the kids of their moms in all sorts of ways. So it's a combination. It's always thinking about nurture or nature. But like you said, that's a discussion for another day. We could go into that and I could keep going.
Yeah. Okay, we've got the last question is, can you share some words of hope with the listeners?
Sure. So look, I think probably the first thing to say is that, there is always help available, no matter how old you are in terms of trying to get pregnant. And we've spoken about the different options, including egg donation and all that. So getting people pregnant is almost always possible, irrespective of the age. If one has the ability or the finances to perhaps freeze eggs, and we should mention that when we're talking about age, it's a good thing to do before the age of 35. You can freeze eggs right up to 35, 36, 37. But, your chances of achieving a good pregnancy is probably better the younger you are when you freeze your eggs. And that's available. So all fertility clinics, I'm sure most fertility clinics in South Africa offer that. So you can have your eggs frozen early enough, and those eggs can be kept for years. So if you're then in your 40s when you're trying to get pregnant, and it's not happening, then you can go back and use those eggs. So there's always something that can be done. But even if you haven't frozen your eggs and you're in your 40s, like I mentioned, there are things that can be done to try and improve the chances of conceiving. So it's not like it's a negative completely. Once you're in your 40s, there is always a chance that you can get pregnant.
So thank you very much, Dr. Olarogun. I just want to, if you please share your details, your contact details with the ladies, so those who have got questions or would like to see Dr. Olarogun, make an appointment to see him. He's at the Hart Fertility Clinic, and I've also mentioned that he's, for those of you that are from Namibia, he's got a clinic at the Cape Windhoek Clinic in Namibia. If you just share your contact details with us, please.
Sure, I will do. So the number at Hart Clinic is 021, that's in Cape Town, 286-2294. For those that live in the Cape Town area. And if you want to email the secretary, it's info@Hart Cape Town, so HART Cape Town.co.za. For the Windhoek people, I'm going to actually just check that number quickly, but it's a different sort of obviously number in Windhoek. If you give me 2 seconds, I'll pull that up quickly, and then just pull that up, and then it's obviously not what we use all the time. So that number will be +264. That's obviously the code for Windhoek, so I lost that there. And it's 612-4268. So that's the number for the Windhoek clinic.
Awesome.
And then the email address for Windhoek is namfertilitydoctor@gmail.com. So namfertilitydr@gmail.com. So that's the email that comes to us.
Awesome. So there you have it, guys. So Dr. Olarogun's at the Hart Fertility Clinic. The email address is info@hartcapetown.co.za. I've got that right. And the Windhoek is nam.
It's namfertility.
DR. Fertility. Yeah. namfertilitydr@gmail.com. Awesome. Thank you very much, Dr. Olarogun. I'm so glad we got to do this talk. And I'm sure there's so many women that just love listening to this, and I'm getting all these hearts here. So thanks, guys, for that. And we hope to have you back soon again when you do have a spot for us.
Sure. Look forward to it. Thank you so much for
Thanks,
having me.
Doctor. Have a great
All right.
evening.
You
Bye.
too. Ciao, ciao.
Bye. Thank you, ladies, for everyone that's joined this evening. And next week, we've got another talk, and it's all about genetics. So please, if you'd love to join us, all our events are on our events page on our website, www.fertilitysolutions.co.za. Go down to calendar, and you can actually mark that events in your calendar, all the talks. If you have any questions that you'd like us to do talks on throughout the year, please let me know. Don't forget you can also purchase any of the products that's available or recommended by doctors on our website, fertilityproducts.co.za. If you're watching on YouTube, please subscribe, please like, and I'll see you again next time. Have a great evening.